So scaling of teeth basically is just a fancy term for teeth cleaning. Okay. So earlier it used to be done with hand instruments. Now with new technology, what we have is we have some ultrasonic vibrations which deliver some antiseptic fluid. So what it basically does is it cleans the hard to reach areas of the tooth and your mouth, the pockets where you're not able to clean very well with your brush, so that it gives you a much better cleaning experience. Basically, the composition of saliva, it has a lot of minerals, calcium, phosphorus, magnesium. Now, anything that you eat and the presence of bacteria in your mouth, which are always there, they sort of leave a layer on the surface of the tooth. Now, this surface layer, it keeps on sedimenting layer after layer after layer with the presence of bacteria, whatever food that we've eaten in the form of plaque and your salivary minerals. Now, this becomes a very concentrated zone of irritation around the gums. If not cleaned at regular intervals, this is what is primarily the reason which causes your gum bleed, your bad breath, your gum disease in the later stages. That's why cleaning regular is more important. Scaling is absolutely painless. But in the more advanced form of disease, as we discussed, if there is already a very concentrated, hard, sedimented layer of tartar around your teeth, it may cause slight discomfort, but nothing which cannot be taken care of by just gently numbing that area. As a blanket statement, we recommend that you come for a checkup. Like I said, you come and say hi to your doctor every 6 months. That's when we decide if you need a cleaning or not. So every 6 months is a good time. But for people with more advanced form of disease, we recommend about 3 to 4 months. So as your dentist will probably evaluate, they will tailor make an approach for you. For most cases, it is between 6 months to 1 year. Consider your teeth cleaning appointment like a spa appointment for your mouth. Okay. So don't really anticipate pain. It should be a relaxing and a rejuvenating, uh, experience. So just don't have a very heavy meal and avoid any caffeinated beverages because they sort of not let you relax while the whole thing is going on. So primarily, as we discussed, the the concentrated zone of your tartar or your calculus, which is there, it becomes a sedimented layer of bacteria. Now, any presence of infection in the body will have some sort of implication or inflammation in your entire body. Just starting with your dental cleaning, you get rid of a major source of infection or inflammation in your mouth, which tends to have a very positive impact on your overall well being. In this age and time, we talk a lot about inflammation. So, dental inflammation or your gums inflammation is something that is overlooked or ignored a lot of times. But if taken care of, it can be a very important step in taking care of your overall health. Now, there is implications and studies where they've connected gum disease to heart condition, gum disease to Alzheimer's. So, gum disease and pregnancy for that matter. Just taking care of your basic gum health by getting your cleaning done can have very long term positive impacts on your overall health. Scaling primarily takes care of cleaning the surface of your teeth, right? So after the procedure, it depends on how well you're able to maintain by your brushing, your flossing, if there are specifically any habits that need to be taken care of. So it lasts for about several months, but some people, depending on their lifestyle and their habits, they need to get it done more often. Now, because there is the zone of irritation around your gums, slight bleeding after the procedure is normal, but it stops within a few minutes. So there's nothing that we really need to worry about. Of course, if you are on specific medications, which, some heart conditions require you to take some blood thinner medicines, we request that you let your doctor know beforehand, but then that is usually taken care of because before any procedure, a proper medical history for every patient is taken. So that I don't think is a very big problem.